In Artesia, New Mexico, on January 27, 2023, 19-year-old Alexee Trevizo committed a crime that shook the entire nation when she secretly gave birth in a hospital restroom and threw her newborn into a trash can. But the real horror began when the body cam captured the moments after. The chilling testimonies of the nurse, the cleaning lady, and the doctor were absolutely shocking. As the police entered the room, every lie started to unwrap, exposing a truth more devastating than anyone could have imagined.
So we started working her up. We did a pregnancy test on her, showed positive. She was denying that she had sex. Then she said she had to go to the bathroom. She went to the bathroom. She was in there for quite a while. We kept knocking on the door. Finally, we got her to open the door, and there was blood and shit everywhere. She was cleaning it up. Okay. So we took her back to the room, and I was afraid that she knew she was pregnant. She had done something to herself. Mm-hmm. So the doctor started doing a vaginal exam on her. We had the lady come to clean the bathroom. She put the baby in the trash can, and then she put another clean liner over the top of it. Okay. So when they looked in there, there was no trash in there, but it was underneath the clean bag. The baby's dead. Okay, we have him in trauma too, but she killed the kid.
Yeah, how old was the baby?
I don't know. It's full term. She just had it. She had it in the bathroom. Was what happened, and then whatever she did, I don't know. She's gonna lie. She wouldn't even tell us she's pregnant. She's been lying the whole time. Okay. So that's what's going on. I just pulled the doctor out of the room, so nothing's been said to the patient or the mother that's in there yet. Okay. I have Leela, the housekeeper, if you want to interview her. Yeah. She's the one that kind of found under the
because I wanted to get with you guys first and then get with her to get her statement before I even did anything.
Well, I'm the charge, and this is what has happened. Okay. You can interview the nurse that had her, the two nurses that were taking care of her. You can talk to the tech, which is Lori. She's the one that went in there and actually found it, because Leela's like, this is really heavy. Okay. So then Lori went in there, and then of course the baby was underneath the clean liner.
Okay. Yeah. If we can speak with Lori, that
okay. I'll get Lori, and I'll get
Leela. So officer, so the first thing though is I need to make sure that the mother, the woman who delivered the baby, is medically stable. Right. Mm-hmm. I don't know if she's delivered a placenta. She's bleeding a lot. I just got her accepted to Loveless, so I need to get her up there as soon as possible.
Okay, I'll get detectives over here right away.
Okay, so how I need to tell her what's going on, and I need to tell the mother what's going on. The mother, they're both in there together. Is one of you willing to be present for that conversation?
Yeah. I'll go in there.
Are you guys going? Yeah. Okay, let's go right now and do this.
While we're doing that, I'll get with
I'll make sure Leela comes down. All the other nurses and stuff are here, and I'll get Leela here.
Okay.
So she's a little shook up. Hey, Maria, will you get Leela back down here? Maria.
I'm sorry, there's we discovered a dead baby in the bathroom.
Oh my gosh. I'm sorry. It came out of me and I didn't know what to do.
Lexi, I told you about this.
But
I just asked you, baby, to tell me the truth.
It was not crying or nothing.
What did you do to it?
Okay, stop right here.
Stop.
Number one priority, guys. Number one priority is she just had a baby. I don't know if she's delivered the placenta. She's bleeding significantly.
Yeah.
I've spoken to the obstetrician at Loveless. They want her up there as soon as possible.
Okay.
I obviously need your permission to transfer her from medicals. She needs to
She's
be
19.
Oh, you're right.
But she is a student too.
She's still 19 years
you're
old.
right. You're right. She needs to. I'm sorry, I forgot she's 19.
Keep out of me.
But you need to make sure that you're safe. I need to send you to Loveless to labor delivery. Will you please agree to that?
Yes.
Okay, great. I'm going to work on that. I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
I know. But the baby's going to have to be taken for autopsy and there'll be an investigator and everything. I'm really sorry, guys. I'm sorry. I'm so sorry, but we need to do this correctly, and I want to be transparent with you about what our steps are going to be. Okay. Officer, do you need to Do you guys need to talk to her before we get her transferred?
How long is it gonna be before you have to transfer
I
out?
don't know. Are we working on?
Okay.
Maria,
So-
do you think 20, 30 minutes?
Yeah, hopefully, yes.
Okay.
I got detectives on the way, so
Okay.
they're gonna be talking to her.
Okay.
Do you guys have, I'm the charge nurse here, do you guys have any questions for me?
Like, how big is the baby?
It's full term.
What? 9 months?
Nothing was crying.
Lexi, have you watched the news of the girls that what they do to their babies and what they go to jail?
Nothing was crying.
Any other questions? Okay.
Okay. So as of right now, like what I said is, we're gonna have the detectives come over here and they're gonna talk to you. Okay. We have to gather some more information about what's going on. They'll get your statement. They're gonna get the doctor's statements. They're gonna get everybody's statements. Okay. So I don't know everything yet. Okay. So I'm not gonna tell you. I can't tell you nothing, honestly. Okay. All I can
But
say
she's
is.
not gonna go to jail.
Right now, she
No?
right now she's being detained, so she's not going to leave from here at all. Period. Okay, so one of us will
She's
be
in your custody? Like,
Yeah, she's detained. Yeah, she's not under arrest, but she is detained. Okay, she's not free to leave. So while this whole thing is coming up, is you're not free to leave. Okay, one of us will be in here the whole time with you, because you're not going to try to leave or nothing like that. All right. Like I said, the detectives will be here. They're going to talk to you. I mean, your care is of the utmost right now, okay? They're going to do what they need to do to take care of you, to make sure you get stable. They get you transferred out or whatever. Like I said, the detectives are already been notified. They're already on the way. So they're going to come talk to you, all right? So don't leave. Don't try to do nothing. One of us is always going to be in here, in this room with you, okay? Unless we have to step out for doctor's orders or something like that, because if they need to examine you or do something with you. But other than that, like I said, you are detained. You are not free to leave at this point. Do you understand that?
yes, sir.
Okay.
Where was the baby at?
I don't know. I have no clue yet. Like I said, I just talked to the charge nurse. We're still getting all the information right now.
Okay.
Okay. Once we get that information, like I said, the detectives, they can clue you in on everything and talk to you more about it.
Okay.
All right. So. Let's see real quick. Do you happen to have an ID on you by chance?
Yes,
Did you
she
bring?
does.
Okay. Can we get that, please? Get all the information. Call it in to dispatch them. Not on radio.
Okay.
Call it in on your phone. Have time I have the record of call. So hang tight right here with her, okay? And I'll be back. Ma'am, could we get your ID also, please? So we can put you.
So, Laura, this is Leela, she's the housekeeper, if you want
Okay.
to talk to her.
Yeah. Okay.
Yeah, I didn't know, so I had her come and
No, you didn't know.
No, you're
That's
fine.
okay.
No, you're
It's
fine.
okay.
So this is the one that happened then?
Yes.
Okay, is there any way I can get this? Where was the trash at? Where's the trash can at?
Yeah.
Okay, they still have everything in it?
Yeah.
Yeah, the baby's out on the bed.
Okay, that's fine. So what I need to do is I'm gonna go ahead and secure, I need to secure this, make sure nobody gets in here no more.
Okay.
So,
Okay.
So the bathroom's locked.
yeah.
I'll order on there.
Yeah, if you can, just put a sign on that, and then you said everything else is in here? That way nobody else
Put
comes in
those
here no
on
more.
this door and that door.
Yeah, just
Then I'll-
nobody else to come in this one and that one either.
Outside door.
So. Oh yeah, sorry. Sorry. Okay, so I'm not gonna ask you a lot of questions, okay? The detectives are gonna come, and they're gonna be the ones to ask you a lot more questions than I am, okay?
Okay.
So what the basic thing is, how did you get notified to come over here to check it out, or?
Lori called me to come clean the bathroom because it was all full of blood.
Okay,
So that's what I was doing, and the last thing I was going to do was throw the trash. And when I picked up the trash, I thought it was heavy, and so I started looking in there, and on the very bottom she had it covered with some toilet paper. And that's when I called Lori and told her to come and look.
Okay. So did you look inside of it at all or anything like that?
Yeah, I looked inside of it, and there's where I seen something, on the very bottom of the toilet paper that covered it up with
Okay.
it in a plastic bag.
Okay. When you looked at it, did you see that it was a baby, or what did you think? You knew already? Okay. All right. Like I said, I don't want to ask you too many questions because the detectives are going to ask you a lot more than I am. Okay. So I don't want you to have to repeat yourself or.
Yeah, it was about like that.
Okay. All right. Do you have your ID on you by chance?
Yeah, I can go get it.
Okay.
It's my
Yeah.
locker.
Okay. Yeah. You could. And then, like I said, once the detectives get here, do you still have stuff that you need to do around here right now?
No, I'm done. I'm okay for now.
Okay.
Yeah.
Because I was gonna say, because if you need to run around still do stuff, it's fine. Just stick around. That way, when
Yeah.
they need you, we can
She
call you.
normally
and
doesn't
come
leave
back.
till 5, right?
Yeah, I don't leave till 5.
Okay, sounds good. If you want to just bring me your ID, that way I have it.
Okay.
And then we'll go from there. Okay.
Okay.
You okay?
Yeah.
I know it's kind of traumatic. So
Yeah, it just bothered me at first,
yeah,
and it still bothered me.
yeah. No, I understand. Trust
I
me.
wasn't expecting that.
Yeah.
I really didn't say anything to her because I didn't know what to say. So.
Yeah. I'm gonna tell her what's going on. So. Hey, Alexee. I know it's kind of tough right now. Okay. I know you're scared. I know everything else. Okay. As of right now, I cannot allow your mom to be in here with you. Okay. So once the detectives get here, then she may be able to come back in here. But as of right now, I can't allow her to be back in here. Okay. If you need something, we're not going to stay in here. Okay. Because I think it makes it worse that we're here anyways. All right. Obviously. And I know you're scared. So what we're going to do is we're going to stay on the outside of the door. Okay. As long as you promise me you're not going to hurt yourself. Okay. Like I said, this is a lot. I know it is. Okay. You're young. I don't want to be in here kind of adding to your anxiety and everything else. Okay. If you need something, just push that button. Okay. And then they'll come in here. They're on the way. Okay. Okay. So as soon as they get here, they're going to talk to you. I mean, the reason why.
Mom be allowed in here?
Your mom, well, not yet. I can't allow her to come back in here yet.
But when they get here.
Yeah, once they get here, then it's up to the detectives, and then you could ask them if she can come back here. If they're okay with her coming back here, then she can come back here. Okay. The reason why is because you're an adult. You're 19 years old. Okay. If you were a juvenile, I would gladly have her back in here. Okay. But being you're an adult, I can't have her. Okay.
Yes, sir.
So, okay. If you have any questions, like say push that, or yeah.
I'm Marina. I'm the house supervisor.
I've met you before.
Yeah, I think so. You look familiar.
Yeah, quite a few times.
Yeah.
So, you want to go in there?
Yeah, sure.
So I'm Detective Gonzalez,
Okay.
for Artesia PD. Can you just tell me from the beginning, like, what
So
happened?
I can actually get the nurses that were involved and the housekeeper, because the housekeeper and our ER tech are the ones who found the actual bag.
Okay. Where are they at?
Let me get them.
Okay. Can you just get the housekeeper first?
Yeah. Yeah, he called me too.
And what's your name?
Lila Lewis.
Lewis? Mm-hmm. Have you worked here a while?
About 3 years going on 4.
Okay, I was like, you look familiar. Hopefully it's from here.
Yeah.
So I'm Detective Gonzalez with Artesia PD. Can you tell me from the beginning what happened?
Okay. Lori called me about 2:01 to come clean the patient's bathroom, and that's what I came to do. And when I walked in there, there was a bloody mess, like a massacre. There was blood everywhere. There was blood all the way up to where she left to go back to the room or came from the room or whatever. And the bathroom was a mess. So I cleaned up everything, the floor, the toilet, and the walls and everything. And I had mopped and everything already, and the last thing I was going to do was throw the trash. So when I picked up the trash, it felt like, because I had looked in it, and just looked at it, and because it had blood, so I had to clean it. So when I picked it up, I realized that it was like a little heavier than it would be with just toilet paper and a trash bag in there. So I looked in there, and that's when I called Lori and told her that I think there's babies in there, because the baby was on the very bottom of it. She had covered it with a plastic bag that had toilet paper in it. She had put that on top of it.
Okay. When you pick it up, can you describe like how was the trash bag how it normally is when you put it in? Did it seem like anything was wrong with it, other than the weight?
Well, other than there was a trash bag that was just laying on top. It wasn't like
Was
you
it
put it on
from that y'all use, or was it from something?
Okay, well, you know how you put a trash bag in it, right? Okay, it wasn't like that no more. It was that trash bag that was full of blood. It was just there, and then the one that had toilet paper in it, they had tied a knot on it, and then they placed it on top of the baby.
And that was just so there's a trash bag in there with just toilet paper, and it's been tied off. And the second one that had the baby was underneath.
Yeah, it was underneath that one with the toilet paper.
Okay. And was that one closed off as well?
The one with the toilet paper?
The one with the baby in it.
I didn't. After I felt that something was in there, and when I looked in there and glanced at it, that's when I called Lori and I told her to come look at it. So.
And when you open it, can you tell me like when you open it how it was arranged? The bottom bag, the one that had the baby in it. Can you tell me how it looked?
The top one was just a regular trash bag, and it had the toilet paper in it, and it was just placed on top like that.
No, the one that had the baby in it. Like when you opened it, can you tell me what's the first thing you saw when you opened it?
I didn't open it. I just seen it. Lori's the one that came in, and she looked in it because that's when I called her.
So what made you think there was a baby in it?
Because when I started looking like that, I could see a baby, but I didn't want to go do anything.
Through the outside of the bag?
Yes.
Okay. All right. And is that bag a bag that y'all guys use here at the hospital?
But yes, there were bags that we used.
So both of them are bags used at the hospital?
Yes, because
Okay.
we leave a roll of trash bags in the bottom of the trash can. So whenever we change the trash bags, we can just use it again. I mean, use a new one.
Okay. And who is this that you said that actually opened the bag?
Lori, she's a clerk.
Okay. And so after you called, did you call Lori?
Yeah,
Okay.
I called Lori.
Like on the phone, or did you just yell
No,
to her?
I just yelled at her.
Okay. Did you actually leave the restroom whenever you yelled at her?
Yeah, I was standing right by the door.
Okay. And what happened?
And then, so I yelled at Lori, and she came in and she called HT, and then there were,
What's HT?
he's a nurse here.
Oh, okay.
And then they took the trash can into
the room? Okay. Did you do anything else after that?
me.
Yes, ma'am.
It was just freaking out
It's understandable.
and just hanging around here, and that was all I've done.
Okay. Just want to know if you did anything else with it. So you just been waiting here?
Yeah, I've been trying to keep busy,
I understand.
but yeah, that's what happened.
Okay. So is Lori here?
Yeah, she's up there. Are you want me to call her?
Yeah, if you always can if you switch out for me.
Okay.
Try not to think too much on it, please.
Okay, I won't.
Thank you.
I'll try not to.
Hi.
Hello. Hi, I'm Detective Gonzalez. You can sit down if you
Okay.
want. You don't have to.
It's just been crazy.
It's okay. So I was told you were Lori?
Yes.
Okay. So can you tell me your involvement with everything?
Well, when the patient went to the bathroom, like we didn't know she was delivering or anything. She was in there for quite some time. So me and a couple of nurses, we kept knocking on the door to see if she was okay. Because she came in with cramping, and then she had a positive pregnancy test. So we thought she was miscarrying or something. So we were just making sure she was okay. And when one of the nurses said, we have a key for this bathroom? And I said, yes. So I went to go get the key, but by the time I came back, she had already opened the door. So when she opened the door, we noticed blood everywhere. And so I called housekeeping, which was Leela, because at the time we didn't know what had really happened. And we did look in the toilet. I did glance in the trash can, and I didn't see nothing. So I called housekeeping to come and clean it, which she did. And then when she picked up the trash can, she called and she says, Lori, she says, oh, come here, the trash can's heavy. And I said, heavy, yeah? Okay. So I put gloves on, and when I removed the bag, because she had placed the bag back in, so I removed the bag, and there was like 2 paper towels like bundled up in there, and then like 2 of the clear trash bags like balled up on top. And so when I did finally get to the bottom, I picked the bag up and I noticed it was an infant because I saw the hair in the face because it's clear bags.
Mm-hmm.
So when I opened it up, I was like, oh my gosh! Like that's when I called my charge nurse and I said, she delivered her baby in the trash. It threw it in the trash. So she like twisted the top of the bag and like wrapped it. So that's why I picked up the bag to open it.
Okay.
And when I noticed that.
So, question for you: why did you look in the toilet?
Because sometimes we've had patients in the past that miscarried and they passed their babies in the toilet.
And you have to retrieve them from there.
We have to retrieve them.
Okay. And you checked the toilet for the trash for the same reason?
Yeah, and I didn't move bags. Like I said, I've never. This is the first time I've ever had to experience this, so that I know for future reference to dig in the trash can. But like we both looked. I think the nurse looked too, just to make sure we didn't see anything.
Mm-hmm.
And then when the housekeeper came, that's when she called, and the trash can was heavy to pick because I picked it up and then I put it back down, and I was like, well, okay, well. So that's when I started digging.
So what happened after you found the infant?
I called my charge nurse, which is HT, and I told him, and then he said, you need to call PD. Mm-hmm. And at that time, I guess, I don't know who removed the baby and put him in the trauma room, and then we pulled the doctor out of room 2 to let her know what we found. And at that time, that's when I was on the phone with dispatch to get police officers here for this.
Okay. And who worked on the baby?
Dr. Vasquez.
So, Dr. Vasquez and anybody else?
I don't know who was in there with her, because at that time I was on the phone with dispatch, giving them the information and everything, why we needed an officer.
Gotcha. And what are you? Sorry.
I'm the ER tech.
So the ER tech? Okay.
Yeah, CNA/ER tech.
Gotcha. And you work night shift?
Mm-hmm.
Okay. Can you have, you said it was HT?
Mm-hmm.
Can you have them come talk to me?
Yeah.
Oh, real quick. Can you describe how you described it? It was tied up, 2 trash bags, or the trash bags, the ones?
Yeah, let me show you. I can kind of give you an example.
Oh no, just were they ones used in the hospital?
Yes, there are
Okay,
hospital
so
trash bags.
everything in there was stuff from the hospital, the paper towels, the trash bags, and the trash bags.
Yeah,
goes
because
in?
we leave a roll of trash bags on the bottom of the trash can, so that way when we pick up the trash, we just pull another bag and lay it in there.
Okay.
But yeah, she.
And nothing was foreign not from AGH. Everything used in the trash can was stuff you can just get in that restroom.
Yes.
Okay. Yeah. Can you get HT?
Mm-hmm.
Thank you, ma'am.
You're welcome.
Hi, Rosa.
Yeah, that's me.
Okay. Is this your family?
Yes.
Okay. Hi, I'm Detective Gonzalez, Artesia Police Department. What questions do you have for me right now?
What's gonna go on? Like, what can I be with her?
She's getting life flighted out right now.
Okay,
So they're taking her right now.
okay,
I haven't spoke to her at all.
okay. So like, what's gonna go on? Like, what's gonna happen with her? Like,
So she's going to get treatment before we even talk to her because she needs to be stabilized. So that's why she's getting life flighted out.
okay,
Once she gets stabilized, we'll try and talk to her. The baby's going to go up north for autopsy. More likely it'll be done within the next day.
is she gonna get detained after, like, she's released? How?
Get what?
Like, are y'all gonna take her into custody or anything like that? Like,
That depends on what the DA finds. We have to wait for the autopsy to come back to see what happened. Because right now with how everything happened, we're going to do an investigation, get more information from the OMI, Office of the Medical Investigator up north. And with that, we present that to the DA, see what the DA wants to do with charges, if any at all.
Okay. Okay. So they already took her out.
No, she's getting life flighted. She's right now being set up to go to the...
What happens?
What do you mean?
Before the DA makes a decision or that?
It should be pretty soon they make a decision. Because with the age of the decedent, they usually expedite autopsy reports and such. With normal people that pass naturally at home, takes a couple months for us to get reports back. Stuff like this, we'll get it back pretty soon.
Okay.
So
Still more, they don't know.
They
we
don't know yet.
we don't know. That's why he'll be going up north. Has y'all's information been taken yet?
He took my driver's license. He took her driver's license.
Okay.
My phone number. Her phone. No, my phone number. Yeah.
So, even though she's of age, if she's not available to be contacted, can we put you down as next of kin for all my? Okay. And you'd be grandmother?
I'm mom.
So you'd be
I'm
the
her mom.
you'd be the descendant's grandmother.
Yes.
Okay. Just wanted to make sure.
So she. That's her boyfriend.
Mr. Boyfriend, do you have a driver's license? Okay. And is the address on you current? On the driver's license? Okay. Because determining on what the OMI does, if she's still in medical, and they do release the infant back, it'll have to be released to somebody. That'll be up to OMI who they determine next of kin is. Maybe the parents, but maybe you, okay? So that's why we're going to get everyone's information. Thank you.
Could I, as soon as they're done with her, like if everything's okay, will I be able to bring her home with me?
Yes.
I will?
Yes.
Okay.
I don't know where she'll be going.
With me?
No.
To my house? I mean, like.
When she gets life-flighted.
okay.
I don't know which one.
They told me Loveless Regional. Yeah.
Loveless Regional?
Yes. Yeah.
That's my card.
Okay.
Keep a hold of me.
Okay.
So if she stays at Loveless and then she gets released, she can go back to y'all.
Okay.
And I'll be in touch with you to try and set up an interview with her.
Okay.
Okay. Would y'all mind talking to me later when y'all are okay?
Yeah, I was with her. I know she talked to him for a while on the phone, and then she came to me, so I've been with her the rest of the time.
Today? Okay. So what did she come here for that she told you?
She told me she had back pain.
That's it?
That's it.
Okay. Has she been having back pain before?
Yeah, pain for her and her hips is no, I mean, she was born with like her, I don't know, it's like crooked.
Her spine?
Okay, because my ex-husband, he hit me. He beat me whenever I was pregnant with her. So she was early. So she had some problems with her hips. Like I always had to take her to chiropractor to get adjusted because she couldn't use, like, she was always getting constipated. Like she had to get lined up, whatever. So, I mean, I've been taking her to chiropractor because I always thought, well, this time, I didn't know. I honestly didn't know she was pregnant. I didn't know. I just thought, like she said, I have back pain. Mom, my hips are hurting me. I think I need to go to the chiropractor. I said, okay, let's go tomorrow. But she was like in really a lot of pain, and
When did it start?
Like the pain?
Yes.
Yesterday she said it was really bad, that her hips were hurting and her back. And then last night we're on the phone together and she said her hips were hurting bad. I asked her if anything else was hurting, and she said just everything. And she went to sleep.
But she's a cheerleader too, so she's big in cheers. They have cheer competition. She works out. I mean.
And she's been active this whole
yeah,
time?
she's been active this whole time.
And who does she live with?
With me.
So
Parents. With us.
Oh.
Yeah, 'cause she's in school. She's a senior. So.
And how long have y'all been together?
Almost 2 years.
2 years? Okay. So, not trying to be rude, but you are more than likely would be the father? Okay.
Yes.
It's,
No, we get it. We get
sometimes
it.
it happens. So with everything that comes with that, gets a little shaky when it's newborn, stuff like that. But with like death certificates, stuff like that, Turping and Sons, if you choose to use them, we'll be the ones to help you get those. Other than that, because that's all really you'd need, and they can help you with the afterlife care, okay? Do y'all have any questions for me right now? Okay. You have my number. You can. That is my work phone. If you want to text me
Okay.
or call me, I have my email on there as well. Okay. Sergeant and I got your information right.
Yes.
Okay. Let me give you my card too, so you can give me a call. All right. Just because I want to make sure everyone stays updated. Okay.
Thank you.
Like I said, I don't know. There will be charges that will be up to the district attorney's office, if any are even done. Okay.
Okay.
It's too early in the game to know right now.
Okay.
So we're just gonna do the initial investigation. I was on the phone with our dispatch, so all mine will be here in 45 minutes. It's one of their field agents,
Okay.
and they're the ones. So in the state of Mexico, we're not allowed to touch anybody that's passed.
Okay.
They're called a decedent. They're the only ones allowed to actually handle somebody. So we wait for them to even do anything. So hospitals allowed to do it because they do care, life-saving efforts. Whenever life-saving efforts cease, no one's allowed to touch them. So we have to wait for them to show up
Okay.
before we even start that side of stuff, okay?
Okay.
So she's getting life flighted out. We'll talk to her later.
Okay.
That's if she even wants to talk to us, if she chooses to, because she still has her constitutional rights.
Should I get a lawyer for her? Should I?
You
I
can,
don't
that's
know.
your choice. I can't tell you what to do. That's something that y'all as a family have to talk about, okay?
Well, why don't we want to talk to her over in Roswell?
Yes.
But I know right here they won't let her.
Yeah, they
She's
wouldn't let us.
Yeah.
she should be gone by now.
Okay.
So that's with the helicopters coming in. They want nobody near it, so that way you can't
Yeah.
mess with anything. Because if any of their vitals go off, they'll stop it,
Yeah.
which could be an issue for if they need care immediately. So that's why whenever someone gets life flighted, they just cut off every contact with the family,
Okay.
because they're making sure she's getting set up to get transported out.
Okay.
So that's why they tell you leave.
Yeah.
It seems
Okay.
very harsh, but it's because with the flight nurse, the flight doctor, they have to make sure everything stays constant.
Okay.
So she should be gone by now because she was already getting prepped whenever I came out to y'all.
Okay.
So with that, like I said, she'll be leaving. We'll stay here with the decedent and go from there, okay?
Okay.
So once she gets to Loveless, it's up to Loveless if they'll let you back there.
Okay.
Because she is of age, so with COVID and how everything goes, it just depends, okay?
Okay.
So if before you make the drive, call, see if that's available,
Okay.
and just let them know what's going on, and we'll just let your family and that if it's possible.
Okay.
All right?
Okay.
We'll be here if you need anything. Yeah, well, I'll be over there, and I'll
Okay.
just be waiting. All right?
Okay. Thank you so much.
All right, folks. Tell me from the beginning what happened.
So,
From what?
okay, so I was doing triage, but I'm the charge nurse. So she came in, she was triaged as lower back pain, uncontrollable. We were going to give her some PO meds, but the doctor said, no, let's just start a line on her. So we put her in there, gave her some pain meds. She was complaining, so about the pain, and we're like, okay. Then we checked her for pregnancy. She tested positive. So we're like, okay, let's get an ultrasound, make sure, you know what I mean? Then she told them that she needed to go to the bathroom. So she went to the bathroom, and they were trying to get her to come out several times. She wouldn't come out, so they had to go get the keys to open it. And I didn't see it, but they said, dude, there's blood all over the place. She's in there trying to clean it up. I'm like, okay, well, move her in there. I thought she's probably tried to do something to herself because she didn't want to tell her mom she was pregnant. That's what I'm concerned. So that's why we set up to do the transvaginal ultrasound, and the doctor did a vaginal exam to make sure she didn't hurt herself. So they were setting all up that, and Lori, the tech, and Leela, the cleaning girl, came and got me and goes, HT, there's something wrong. So I went in there, then the trash can was there. I couldn't really see, so I kind of broke through. There was a clean liner, and there was a couple of balled up trash bags, and then paper towels, and then there was another bag underneath that in the bottom that was all wrapped up. When I broke it open, I could see the hair. So I immediately went to trauma 2, got the baby on the bed, had the doctor come in there, of course. There's no vital signs whatsoever. The baby was already cold and blue, so she determined that no resuscitation, so she called the death. But that's what I found. I had to break. She had taken it and put it in the regular trash, and there's still trash all around the baby. She put it right in the trash can. Then she twisted it and wrapped it underneath him, and then set the baby in the bottom. Then she put paper towels on top, and then 2 wadded up trash cans or liners. They were clean on top of that, and then she placed a brand new clean liner in the trash can like it was ready to take trash. That's what I found.
Okay.
And then, of course, the baby was nothing we could do. I found the baby. I guess they had picked it up, and she felt the weight, and she freaked out. Then Lori, I guess, kind of looked at it. I don't know what Lori did. They just came and got me. I picked up the weight. I felt the weight. I broke open the bag. I could see the hair, and I just went right
Straight in?
there and went and got Dr. Vasquez and said, hey, this ain't good. And I just pulled her out of the room. I didn't say anything to anybody. I just pulled her and said, hey, man, there's a baby in the trash can. And I said, it's dead. But we went over there. We checked him, and, it's dead. And I left him just like that. I did pull apart all the trash cans to get him out.
Right.
But we placed him on the bed, and that's where I've left him.
Okay.
So
So you said cold and blue already?
Cold and blue already. His temperature was like 95. No signs of life, no breathing, no respirations, no heartbeat, nothing, no movement whatsoever. So I know that they were concerned, and when they talked to me, I was concerned that she had done something to herself because she knew she was pregnant. I didn't think that that was going on, but she was totally deceptive with them. And then when they got her in there, I go, what the hell's going on? She said, oh, it's my period. But there was blood all over, so that's when I thought she probably tried to hurt herself. That's what I told them. She probably tried to hurt herself. We need to do so that's when we were going to do the vaginal exam and all that stuff. But she never said anything about the baby. She never said anything till I went in there with the police officer and Dr. Vasquez and confronted her that we just found a full-term baby in the trash can. Then she said to me, he wasn't breathing or anything. And I said, well, that doesn't matter right now, but that's what she told me. I don't know. I don't know if she did something in there or not to the baby. It doesn't really matter to me. I see it as she let him die no matter what the hell went on as far as I'm concerned. Because she knew he was in the trash can. She didn't say anything to anybody, and she tried to cover it up. That's how I feel. So that's...
You're entitled to your opinion, so. But I appreciate it. You said she was deceptive with people. Who was she deceptive with?
With the nursing staff and the doctor. Because they were asking her about her periods, and she said, no, I'm on it right now. I had one exactly 1 month ago. You know what I mean? And then even after they told her that she tested positive for the pregnancy, she was telling her mom, no, I haven't had sex, Mom. I haven't had any sex. I haven't had any sex. That was before she went to the bathroom.
And this is a 20-year-old.
She's 19.
19.
Now. Yeah. So, I'm pretty sure, I mean, my opinion tells me that she was pregnant, she knew it, she was scared shitless because of the way her parents are, and maybe the stress of what was going on made her do what she did. Whatever she did, I don't know. I can't say that she killed the baby. I just know that she was very deceptive, and she put the baby in the trash can and didn't say anything to anybody, and you know what I mean?
You're right.
And definitely tried to cover the shit up.
Yeah.
I mean, a lot. You know what I mean? So, that's it.
Thanks
That's all
for
I got,
talking
boss.
to me. Well, I appreciate it.
Yep.
After the intense confrontation inside the hospital room, Alexee Trevizo was officially arrested and charged with first-degree murder and tampering with evidence. The case sparked massive outrage across the country, turning into one of the most heavily debated legal battles in recent history. As of right now, Alexee is out on bail, waiting for her final trial, where she faces severe charges that could lock her away for decades. If you are interested in the most intense crimes and incidents captured on Bodycam, make sure to subscribe to American Bodycam. Thank you for watching, and we will see you in the next case.